Okay, so I'm going to give an update on COVID-19. Hopefully, I'm going to cover a lot of the areas that people have got any concerns or questions about. It's quite a detailed presentation, but I'll be able to take questions afterwards as well. I'm going to cover how it's going to affect us and talk about some key messages, what we need to emphasise in terms of our own personal care and also for any friends and family. So many of us are used to seeing normal viral illnesses every year, which are really common. So viral illnesses are your normal common colds that people pick up every single year. So when you have a runny nose, a cough, a sore throat, any sort of temperature, they normally last between 7 and 14 days, and they're spread by droplets and close contact. This year, or starting from the end of last year, the big thing that everyone's been talking about is COVID-19. Now, what is it? It's a new or a novel coronavirus. Now, I mentioned viruses are very common. Coronaviruses are common. This is just a new type. They say that it most likely started from a similar virus that was found in bats, and then it transferred into humans. There have been other coronavirus outbreaks before, so many of you would have remembered or heard of SARS and MERS, and again there were viral outbreaks that actually occurred at a period of time and then eventually finished. The majority of people who do get coronavirus or COVID-19, the disease, in the majority of people, it's going to be mild. So that's probably going to be one big key take-home message from me. It doesn't mean that it's not serious for all of us, and hopefully I'll explain why that's the case. But for people being affected, especially young, healthy people, in the majority of the time, it's going to be mild. It does have an incubation period, which means before you actually exhibit symptoms, you can still be infectious, and is spread by droplets. So trying to kind of prevent any spread is really important. So what does it mean that it's spread by droplets? So sometimes you'll feel that the virus is somewhere all around us in the air, and you can just catch it just from the air. Now, the current thinking is the virus actually, because it's spread by droplets, is actually caught when droplets from the virus actually enter either your nose, your mouth, or your eyes. Okay, so that can happen in a couple of ways. If you're unfortunate enough for someone to cough or sneeze directly at you, of course, that's one way it gets into your nose, your mouth, or your eyes. A more common way is someone coughing or sneezing into their hands. So they cough into their hands, and then it's actually on their hands. And when it's on their hands, after a while, they then shake somebody else's hand or touch an object that somebody else then touches, like a door handle, and then it's on the other person's hands. So someone else coughs and sneezes onto their hands, shakes somebody else's and passes it on to them, either directly or via a door handle. Now, when it's on your hands, it's really hard, and hopefully I'll try not to do it myself when I'm speaking, it's really hard not to touch your face. So often where we've got our hands on our face, rubbing our nose, our mouth, or our eyes, and when I've given this presentation live, you can almost see people changing their behaviour as you're speaking, because it's quite hard not to do. And that's the reason. That's the way it gets transmitted. So your hands from an infected person, and then you then touch your own face, mouth, or nose, and that's why the key message, the really, really key message, is wash your hands. Probably act as if we've all got it. But we don't want to transmit it through to our eyes, nose and mouth. So wash your hands with soap and water for at least 20 seconds, making sure you're doing it in between. And I'll go through it in a bit more detail, how to kind of wash your hands. That's probably really the most important thing that we can do, because as I've mentioned, prevention is key. I've got a slide on the timeline, and it started at the end of last year in China, and it was announced as an outbreak by the World Health Organization early on in January. The first exported case was to Thailand on the 13th of January, and in the UK it was on the 3rd of February. The cases that many people are talking about in Italy, their outbreak really started towards the end of February, and then you would have heard the the COBRA meetings that the Prime Minister had as an emergency. That actually started happening in March, and then from the middle of March, the 16th, as we've all noticed, there's been daily Prime Minister briefings. As it stands, there are 248,000 cases globally and 10,000 deaths. That's as of today, but today's final figures haven't been released just yet. And in the UK, the deaths are 3,200, and 69. Sorry, the cases are 3,269 and the deaths are 144. So there are still a lot of people who have had it and have recovered and have come through and are fine, because in the majority of people, of young people, it's mild. It's just that the deaths are increasing because it's spreading wider and the cases are actually getting bigger. In London in particular, that would be seen as probably in England, that would be the kind of the epicenter of the outbreak. So you'll see in London, there are quite a few areas where the spread is higher, and actually, if you can look at this map, it actually just highlights the darker colours are where more of the cases are in London boroughs. So that just gives a bit of an idea that certainly in central London, that seems to be where the virus is spreading. So some important facts I'll mention again, and I'll mention some things a few times during this presentation. It's usually mild. It affects older people worse than younger people. It's spread by droplets, and they're doing approximately 7,000 tests per day, and I'll talk about testing a little bit later on. And they're due to, after yesterday's announcements, due to increase that significantly further. This graph on the right is from some of the early data from China, and I just want to highlight just a principle. In blue, on the left is the age group, and then at the bottom is the amount of cases and deaths as a proportion for each group. So the cases are in blue and the deaths are in red. So as you can see, most cases are happening between people between 30 and let's say 70 from that graph. So the blue, most cases are in that age group. But actually most of the deaths are happening in the older age group, particularly above 80, above 70, and certainly above 80. So that just kind of gives you an idea. And in that data, there were no deaths reported in young children, and still very low in children and pregnant ladies. And very similar data in Italy in terms of the spread. So just various graphs just showing the main demographic is older people who are getting more seriously affected. The government talked about their strategy, which is a well-known public health strategy of contain, which is trying to kind of isolate the cases initially, and then when you go through that phase, we're into a phase called delay, which means that the outbreak is going to happen. We're trying to delay the impact. And that's where it does start affecting our lives in terms of what we do socially. Ongoing throughout all phases, there's research and treatment, and hopefully this will be the answer ultimately, because there's research going on looking not only at current antibody testing, at treatment of the virus if people have got them, but also vaccination in the future to prevent similar happening again. So we're delaying a lot of these things in order to allow the scientists to really push forward on that kind of work. And then finally, mitigation, when actually the outbreak is happening around us, and we have to again reduce the impact of that on our lives. And hopefully, I'll touch upon that as this presentation goes on. So public health measures are really, really important. Okay, sports events, as we know, globally have been suspended, and that's the right thing, because any large gatherings or congregations can lead to spread of that virus, and as we've said, we have to try to prevent that spread, particularly in the vulnerable, who are usually the elderly or those with comorbidities. We'll all hear of terms like self-isolation and social distancing. I'll go through those in a bit more detail. What's happened as of today is school closure, which is welcome by the majority of medics. I say the majority because it's a difficult decision, because school closure impacts all of us in terms of our own lives and also medics' lives, because then they have to decide about where those key workers are going to focus their energies, whether it's going to be looking after their own children or actually going into work. So that's why that decision by the government was a very considered one. The reason why it's good from a public health perspective is children do pass on. They're in close contact, so they pass on viruses amongst each other. So even though they're well, they will then pass it on to onto other people, adults, and it just spreads further. And I'll show some graphs just to show that the impact of school closure and social distancing, and why the government have made these kind of decisions. Other ways it's affecting us is working from home, and I know some people have started to do that already, and the effect on travel that's happening currently and is only likely to kind of increase. So the first thing, self-isolation. So this is for people who've got symptoms. So if anyone's got symptoms of COVID-19, and I'll go through them now, it will be having a fever or a new continuous cough. They're the two main symptoms. Other symptoms, as you can with a normal viral infection, you can get a sore throat, you can get muscle aches, and you can feel very tired. You can get a conjunctivitis that can precede a lot of the symptoms that I mentioned. But the two questions that you'll always be asked about would be, have you got a fever? And if you've got a temperature, a thermometer at home, you can check that your temperature is above 37.8, and whether you've got a new continuous cough. So anyone who's got those symptoms needs to isolate for 7 days. Any family members, so if, for example, somebody else at their home has that and you go and you live in that house, then the advice is that you have to then isolate for 14 days. And the reason why you have to isolate for longer is because at any of those 7 days, you could catch the virus. So if you catch it on day 7, then you are then infectious for the few days before, which is why you have to be isolated, and also for the next 7 days. So that's why those more stricter guidelines came in about 14 days. If you want any advice and you've got mild symptoms, then check 111 online. And if you're unwell, again, you can call 111. Try not to go to your GP or to hospital, because the system's going to get clogged up. And I'll explain that in a bit more detail after a while. But for mild symptoms, the majority of cases can be managed at home with the normal advice that we give in terms of rest, paracetamol, fluids, and watching out for any signs or symptoms that they're getting worse. Now, those signs or symptoms would be becoming short of breath, getting drowsy, getting confused, getting dehydrated. But if it gets to a stage where you're worrying about those kind of aspects, then of course then call 111, or of course then call your GP. Most GPs will then have a telephone consultation, and again, in the majority of cases, you'll most likely get advice at home about what to be able to do in those situations. So social distancing, now this is the big one that really does affect our lives, and I think it's important that we all consider this and think about this, because it actually should affect our lives if we do it properly. And remember, the aim for this is to make sure that spread is not happening among the community as quickly as it has been happening, and so we try to prevent that spread, in particular to our elderly and our vulnerable patients. So avoiding contact with people with a fever or a new continuous cough, I think that one's fairly obvious. Avoiding the use of non-essential public transport, and trying not to use the public transport at rush hour. Trying to work from home where possible to help facilitate that. Avoid large gatherings, we've talked about that already in terms of going to big sporting events, but also smaller gatherings in public places like pubs and cinemas and restaurants and theatres and bars and clubs and gyms. So the list does go on, but if we understand the reasons for it, then I think hopefully we can start taking that message more seriously. Keep in touch with family and friends, mainly by other measures, if possible, using the phone, internet, social media. And if you do have to be in contact with people socially, then to stay 2 meters apart. That's the guidelines from our country. Actually, the World Health Organization says 1 meter apart, but we'll stick with our guidelines, so 2 meters apart. And a lot of these things are really difficult because they're a complete different way of living. And I think once we accept that there's something significant or serious going on, and understand it, we could then start making some of those changes. And if it happens on a small level for each of us, hopefully it will then lead to this virus not spreading as quickly as it has been. So vulnerable groups. The message that I gave about social distancing has to be more stringent in these groups. So who are vulnerable? The elderly, who are above 70, so they're the ones, as I've shown you in the graphs before, that are being most severely affected by this. So that goes without saying. Those with pre-existing conditions like heart problems, lung problems, liver, kidney, neurological problems, and diabetes. They're really important to make sure we look after them, that we're really careful in terms of our interaction with them, and they themselves are careful in following the social distancing advice. Asthmatics are an important group because that's probably the group out of all of them that affects younger people. There is still some debate about which kind of asthmatics, because as we all know, there's a massive range. So there's from mild, moderate to severe. Some people use blue inhalers, some use brown inhalers, some use them as kids and don't use them afterwards. The current advice is for asthmatics to be more careful in that group. It doesn't really kind of say specifically whether it should be for only severe asthmatics. So it's hard for us to kind of veer away from that. But do make sure that those groups are socially distancing as advised as much as possible. And the final group I've just put up there is those who are on immunosuppressant medication and steroids. There are a few other smaller ones like sickle cell anemia as well. And as of yesterday, the government also said to take extra care with pregnant ladies as well. Now, that's not for any specific reason. There's not been any big spike in pregnant ladies. It's just the data's not there about what could happen for pregnant ladies who pick up this. So it's worth being extra cautious in that group. And as it stands, last I checked, which was early this morning, there's no reported deaths of any pregnant ladies with COVID-19. But that group often does come up as one to be more cautious with, and understandably so. You'll hear this phrase quite a lot of flattening the curve, and now I'm just going to go on to explain why we're taking it so seriously, why we're having to maybe affect the way we live, because what is going to happen is going to be quite an impact on healthcare services, both in primary care and especially in secondary care. So you'll see on the left, you'll see the number of cases with it rising, and you'll see the horizontal abbreviated line going across. That's the healthcare system's capacity to deal with an epidemic or with people coming into hospitals. And you can see that if we don't do anything, then there'll be a big peak, and then all the services that we use and that we're lucky to have in this country will get clogged up really quickly, and that will have a knock-on effect for us, which I'll go on to explain. So some of these measures are put into place: the school closures, the social distancing, to try to flatten the curve. So as you can see on the right, the cases still will occur, and the spread will still happen, but over a longer period of time, over a more delayed period of time, in which case, and by then the services will be able to cope with it, and so it won't have a knock-on effect of people with other illnesses. So here's another slide. Now this is specifically for critical care beds, and I take quite an interest in this anyway, because my brother's a consultant anaesthetist at Guy's and St Thomas Hospital, so he's actually working really at the front line with people who are coming in with these kind of illnesses. So if you look at the bottom, so on the left is the amount of critical care beds that are occupied, and as time goes on, this is the predicted outcome if we do something or if we don't do something. So if you look at the bottom, the line in red, just to, not too far above zero, is our ability to cope, or hospitals' ability to cope with critical care admissions into them. So these are by critical care, I mean the people who are intubated, like a tube into their throat, and on life-saving machines. There's not a massive capacity in this country of those kind of critical care beds, and if we don't do anything, there'll be a massive rise or a massive peak in the amount of people who are required or who might need admissions for those, and then the system will just clog up, because ITU consultant beds will be used up, theatres will be used up for extra capacity, all routine operations will be shut, and then it will just work backwards from there. Then A&E will get clogged up, and then more people who should have gone to A&E will have to be managed by primary care. So you can see, if you just stop things, or things get clogged up right at the highest level, it will have knock-on effects all the way down the chain. So it's important that we actually do follow the case isolation, that closing of schools that's happened, and that social distancing, because it actually will make a difference to when that peak happens. And if we don't do anything, this is just another slide just showing the amount of deaths that are happening in various countries, and the one that's going quite steadily rising is still Italy, and you can see that we're quite a way behind in the UK in terms of our rise or our peak. So ours is on the left with the purple line, so you can see it's quite a sharp increase in the amount of deaths that happen over a short period of time, and what we want to do is try to flatten that curve as well, so the deaths don't just rise as much as Italy. Otherwise, similar could happen in this country, and that's why we're all taking this seriously in terms of social isolation. Okay, so moving away from those kind of aspects, so just some important facts. It's already spread across lots of continents, so we can see that. So that's already happened. I get asked a lot about masks and whether people should wear masks. As it currently stands, masks are only recommended for symptomatic people who are symptomatic. So if you've got a cough or a cold or symptoms of COVID-19, then you should wear a mask. But really, you should be at home self-isolating anyway until you're better. But if those kind of patients are going out, they have to. The evidence shows that wearing a mask is beneficial, and also for medics who are doing the testing of people. So they're the only two. So that's what's recommended at present in this country. Testing currently is only recommended for those who are likely to be admitted into hospital. I've mentioned the 111 service. I've mentioned that GPs and hospitals are under huge pressure, and we've talked about social distancing and self-isolation. Some questions I get asked a bit more specifically about football. So handshaking was one of the early things that we stopped at our club and at some other clubs in the beginning. And then, as I've mentioned, we've started looking at other measures, and eventually we've got to a situation where the leagues have been suspended. In football, we're in close proximity within clubs. There's a big handshaking culture. Often our players and staff who are overworking have their immune system can be down, so they can pick up infections. There's also a lot of travel for players and for staff, and also for fans, and many of whom are in that elderly or vulnerable group. And so the decision we made about matches being postponed, and we acted on that straight away, and we've also stopped all training ground activities at all of our sites. So what can we do on a personal or a practical level? It's good to kind of follow some of the measures that I've said, but also do just general good healthy lifestyle things in order to make sure that our immune systems are as healthy and as good as possible. So just on this slide, things on the left are things that worsen the immune system, and things on the right are things that boost the immune system. So making sure that we have good adequate rest and that we're hydrated, look after recovery and vitamin D, and training loads, they're more for our athletes, but ourselves having a balanced diet. And if you're in a category that requires having the flu jab every year, making sure you're seeing your doctors for that. And now, just to reiterate, I'm going to finish off just reiterating on some of the really important measures and things that we can do. If you're coughing or sneezing, then catch it, bin it, and kill it, so not onto your hands. If you've got tissues by your side, to kind of use those and throw it into the bin and then wash your hands afterwards. If you haven't got a tissue by your side, then again, not to just sneeze into the open air or onto tables or into your hands. Just use your crook of your elbow, so just sneezing into your elbow, just like that, or your upper arm. And then still going on to kind of washing your hands appropriately. And what does appropriately mean in terms of washing your hands? With soap and water for 20 seconds. So if you see alcohol gels lying around, or at various workplaces, or even at home, you can use them to supplement things, or if it's hard to wash your hands, but just washing your hands in soap and water in a proper way, making sure that you're doing it. And I've just doing it properly, so the next slide just shows some of the areas where you need to kind of focus on. Often people just focus on the palms of the hands, but making sure you're washing in between your fingers, making sure you're washing in between your thumb areas, and also the back of your hands around your nails as well. Then to close the tap, you can use the other part of your elbow, or the cleaner part of your elbow, or your lower forearm, just to close the tap, and then just dry your hands and throw it straight into the bin. So making sure that it's actually something that you do properly. 20 seconds is quite long, and long enough certainly. Using tissues, I've mentioned, for coughing and sneezing. If not, you can use the upper inside part of your arm. And then really, really important, stop then touching your eyes, your nose, or your mouth in particular with unwashed hands. Avoiding close contact with those who are unwell, which I can appreciate is not easy, especially if you've got some elderly people at home and loved ones at home. And hopefully we'll kind of take some questions afterwards related to those, which I can try to kind of give some practical tips about. And this slide just kind of shows it in one slide. Watch out for fever, tiredness, breathing problems, cough, and muscle aches. And if you do, then cough into your arm and follow the advice that we've given. 111 is getting clogged up, that service as well, so try to use the online version, but ring if it's appropriate. You can also ring and ask for a telephone consultation with your GP, who can then either advise or arrange to be seen if it gets to that stage. But usually you'll be advised to be seen at home, because usually the symptoms are mild, and if testing is required, you'll be advised about that and how best for that to be arranged. I've got this slide about some top tips that we give out to footballers, but we've actually just kept it out for a lot of our staff as well. So if it's something that's useful, then people can kind of have a look at it. But it just gives some general advice for some people. So it's quite a useful kind of thing to have to remind you of good things to keep you healthy. And so just my last slide, just some take-home messages. It is mild in the young, but it can be potentially dangerous in the elderly and those in at-risk groups that I've highlighted. Self-isolation if you have symptoms, or if you're in a household of people with symptoms. Social distancing for all of us, especially those in vulnerable groups. And again, that's a personal responsibility that we all have to take on board, I feel, at this time. GPs and hospitals are under huge pressure, so when you're looking to access those services, do bear that in mind. And yeah, just to kind of firstly accept that our lives will be affected for a period of time. Hopefully it's a short period of time, but for a period of time our life will be affected, and then we'll get through this together in terms of personally, but also as a community. And just reiterate, good cough etiquette, tissue or into your arms, and washing your hands for at least 20 seconds with soap and water.